Nutrition plays a major role in the management of COVID-19, according to experts. Government in the early stages of the outbreak of the novel virus in Ghana provided meals to help boost the immune system of patients as well as speed up the recovery process. It was part of the government's comprehensive care for COVID-19 patients at isolation and treatment centers. However, nearly a year down the line, checks at the Tamale Treatment Centre revealed that feeding of patients by government has halted for almost 5 months now. A patient who spoke on condition of anonymity said the situation is worrying and asked authorities to address it immediately.
Since I came here, they've never provided any food for me. At least I was expecting the authority to provide 3 square meals that will boost my system, and then I don't have to go outside and get food for myself. That is my worry. My sister always brought the food out from town, and then she will come and stand outside on the door so that the nurses will collect and come and give to me.
Meanwhile, recent test result from the Tamale Veterinary Laboratory shows positive cases has risen by 50% in the month of January. This is according to the deputy in charge of the treatment center, Samson Danfo.
From between the second and third quarters of last year, the cases were on the rising level. But from, let's say, late third quarter to the early fourth quarter, the ladder started declining again. But from the latter part of last year till now, we have seen another surge increasing in numbers of COVID-19 positive cases. Normally, we gather our samples not less than 3 days, because when we send our samples, the other is we shouldn't store samples more than 3 days. So maybe a day or two, we send it for testing. And for instance, last week, Friday, we sent samples and we received the result on Saturday. And out of 16 samples we sent, 8 were positive. That is 50%, which is highly unacceptable.
Speaking on access to testing facilities, he noted that the center relies on the Tamale Veterinary Laboratory for only clinical cases. At the Tamale Veterinary Laboratory, the director in charge of the facility, Dr. Emmanuel Aleje Kujo, said the lack of adequate staff is affecting their delivery, although the turnaround time still remains 24 hours.
We are understaffed. We only have a team of 5 laboratory technicians and the lab director working on the samples. So that has been our main challenge. But we are managing the samples that are coming to the lab. Our turnaround time still remains 24 hours. From samples reception to the release of lab report, all occurs within 24 hours. And we are still doing that.
Back at the treatment center, frontline health workers want government to fulfill the payment of the 50% incentive it promised, adding that they received payment for just 3 months since last year.
Yeah, we are doing our best for Mother Ghana. Yes, just that the incentives are not coming. So our motivation is somehow not encouraging, but we are doing our best.
They gave us 3 months allowance. Up to now, they've not yet. Since June, they paid up to June. So July up to December, we've not received anything yet. Our appeal is that we want authority to come out. If the problem is from them, they should trash it out. And if it is from the national level, they should let them know that we are not satisfied, we are not okay with what is going on with us.
However, an observation of the Tamale metropolis revealed fewer people observing the COVID-19 protocols. With the current surge in COVID-19 cases in the region, health workers are advising that government should intensify its efforts in educating the public to observe the safety protocols to avoid the spread of the virus. From Tamale, I'm Dinah Ngon for Citi News.